Thank you for listening to this PYA webinar recast. PYA is pleased to offer this alternative way to access our thought leadership. This is a recording of a previously delivered webinar. The information is accurate as of the date of the original event. The video recording, slides, and associated material for this and all PYA webinars are available on our website at pyapc.com. This podcast is for educational purposes only. It is not intended to be used as legal advice or an official opinion. Good morning, everyone. Welcome to the latest episode of PYA's Healthcare Regulatory Roundup webinar series. Today's topic is 2024 General Compliance Program Guidance, Updates, Key Insights, and Recommendations. PYA is happy to present today's webinar on this important topic. With that, I would like to introduce our presenters, PYA Principals Tynan Kugler and Shannon Sumner, and Senior Manager Traci Waugh.
All right, well, good morning, everyone. We are so excited to talk about this topic, and we have actually presented this a few times, but I think every time that we prepare for this, we always learn something new. I'm Shannon Sumner. I am one of the principals and owners with PYA. I lead our regulatory compliance service line. And as such, we work very closely with clients of all different levels and all different sizes related to compliance programs. And this is something that we are certainly seeing a lot of activities related to compliance programs and integration in some of the advice and counsel that we've heard from our clients related to compliance programs, but also how they're interpreting some of this guidance. And so we're excited to speak to you today about this. Tynan?
I'm Tynan Kugler. I'm a principal with PYA as well. I spend the vast majority of my time in our compensation and service valuation practice with some focus too on physician planning, compensation planning, and design. I have worked with Traci and Shannon on a number of different compliance matters, and my interest in this particular topic is how the guidance impacts what we're seeing in the physician compensation and services valuation area. So thanks for joining us today. And as Shannon said, yes, we always learn something new from this, and there always seems to be something new to present. So Traci, turning it over to you.
Great, thank you. Thanks everyone for joining us today. We're excited to share some insight with you all and encourage feedback and questions. I'm a senior manager with PYA, and as some of you, I was really excited for the guidelines to come out. I much prefer reading this document than combing through the Federal Register, unlike some of my other colleagues. So I'm really excited to go over these topics today. So in general, we're going to go over just some highlights from the General Compliance Program Guidance. There is a general focus on risk. We'll provide you some action steps and then discuss some enforcement action that has been occurring. So first of all, if you haven't seen, this is what the front page of the document looks like. And within, so here's the reference for you to go to it directly. But what's important to know is that these guidances, it's voluntary and not binding, yet the goal that OIG has in mind is for it to realize it's not one size fits all, and it's really set forth to give you tips to identify risk areas that the OIG believes healthcare entities should be taking into consideration when they're either developing or implementing a new compliance program or evaluating a program that has been in existence for a while. And the guidance also provides helpful tools for a variety of healthcare programs and supply companies, as you see listed here, ranging from hospitals to home health to DME, even into Medicare Advantage organizations. A little background, as promised last year, back in April, that the OIG was excited about publishing new compliance guidance for us. And so they delivered that, again, as indicated in November of 2023. And as I already stated, it reads a bit differently than what has normally been published in the Federal Register. In fact, going forward, any updates will no longer be published in the Federal Register, but on the OIG website. And what I really appreciate about the guidance is it's sort of an easy read as you go through. It's really meant to be a searchable document, so you may see some repetition throughout, but it also provides you many links to other resources that the OIG feels important for you to understand when you're looking at your compliance program. So if you're one of those that really likes to print documents and have them available for quick reference, keep in mind, if you print this guidance, you'll be missing lots of the content if you don't click on all the links and print those as well. So you may come up with the 91 pages when you print, but if you go to all the links, you'll have a much thicker document to look at, so keep that in mind. Also, there's discussion that just talks about key laws in healthcare and fraud enforcement, and throughout the document there's tips that the OIG has provided, as well as some key questions to ask yourself as you're going through. And lastly, the OIG really does want some feedback. So they have provided an email address for healthcare communities to provide feedback to the OIG and possibly questions, not necessarily those, we're not sure how those may be addressed and answered, but keeping in mind they really do want some feedback. What is rewarding is also that they maintain the 7 elements of effective compliance program that the U.S. Sentencing Guidelines had published. So throughout the document, they maintain the 7 elements and provide that feedback. So we have the written policies and procedures, compliance oversight, training and education, effective lines of communication, enforcement standards, auditing and monitoring, and responding to detected offenses. So throughout the guidance, you will see each of those elements addressed with different key guidelines that the OIG has provided. So that's a nice, mechanism that we can continue to use throughout our organization as we look at our compliance programs. So next, we have our first polling question. So I will hand that over to the moderator.
Yes, so now we have our first polling question. The OIG's General Compliance Program guidance is voluntary, mandatory, voluntary except for some provider types, example, skilled nursing facilities, Medicare Advantage plans, non-binding, or a long time coming. Remember, you must fill out the polling questions in order to receive CPE credit. You will have 30 seconds to answer. Thank you for participating in our poll. Now I'll hand it back over to our presenters.
Thank you, moderator. Okay, so we have 40% voluntary, 28 mandatory, 18 voluntary, non-binding. All right, appreciate that feedback. And I am going to hand it over to Tynan because our next slide talks about themes within these guidance that has been published.
Thanks, Traci. I think I might take us back. I think it looks like we may have missed a slide on the what's to come. So maybe we can go back to that, or I can just talk from that. Did you want to cover that one, Traci? I'm happy to.
Oh, You are sure right. I missed that. Thank you. So
We were so excited to get to our polling question.
I know, exactly. So
and this is the part that one of the things I'm most excited about this, so I couldn't let it pass.
thanks, Tanya, for reminding me. So as we indicated, there will be some industry-specific guidance coming through, and that will be coming out throughout 2024. And they're really wanting to focus on those subsectors to give some specific guidance. And what was published in February is that the next set will be Medicare Advantage and nursing facilities. So the guidance will be provided on those particular subsets. And then what we're anticipating the next set to be will be on hospitals and clinical laboratories. And I guess I already talked about the feedback. They're really excited about the feedback, and I think I must be too.
So I can take us to the next slide. And one of the things that was really interesting to me about this were those industry segment sections, because as we look at the requests that we get, both as it relates to valuation, but compliance with policies and procedures, commercial reasonableness. Those areas that they have highlighted, Medicare Advantage, skilled nursing, hospitals, and laboratories. I mean, those are the four that I would say in the last several years we've seen an uptick on, just from a evaluation perspective, quite candidly. So, I'm going to walk through the themes, then we'll talk a little bit about one of the areas that is near and dear to my heart. But the overall themes, and I'm going to ask Shannon and Traci to jump in here as well, but is that, different from sort of pre-publication, is the OIG's made it clear that they are maintaining a broader or sort of higher level focus, I'll say. So they're kind of making sure that we're not just talking, for example, about the structure of a compliance program, but how effective is that compliance program from an operational standpoint. So in other words, you can have a compliance program, you can have a well-defined compliance program, but if that compliance program is not effective and isn't operationally implemented effectively, that's part of one of the things that they are focusing on. The other thing that I know, we all live in healthcare, we know that healthcare is fluid. We know that things change every year because Medicare changes every year. But the other thing that the OIG has sort of at a high level focused or said they're looking at is, compliance challenges aren't static. They can change based on different laws. They can change based on different events that occur throughout the year. So the obligation of an organization, as they're thinking about identifying and implementing the risk assessment, is it's fine to come up and develop here the areas we're going to focus on, but it doesn't absolve organizations for looking at and pivoting if they need to, in focusing on those compliance risks. So one of the other areas that's interesting too is, we typically think about the compliance officer, the chief compliance officer, as the one who is responsible for anything and everything compliance and risk assessment. And while that individual, often leads the charge there, the OIG has really kind of broadened that to say that it's not just the responsibility of the compliance officer to ensure that compliance activities are in place, but the compliance committee has a significant responsibility in that respect too. So it really broadens the organization's need to commit to what that compliance officer has identified and make sure from a cultural standpoint that's in play. And then the final one is, it's not, again, just the compliance officer, but the compliance committee, the board, and also of interest is, when we say PE there, we mean private equity, is, given the participants of private equity in healthcare now, the accountability also falls to those organizations to ensure that there's compliance. So owners and operators of private equity organizations are not absolved from having to be accountable from a compliance perspective. So Shannon, Traci, anything to add there before we move to the AKS part?
Yeah, Tana, I'd like to add to this. One of the things that we're also seeing for organizations that are under corporate integrity agreements. So we serve as both independent review organizations. We also serve as compliance experts for those entities that are required to have either one or both of those types of, individuals or firms as part of that. What we are seeing now is you've probably heard about transition plans for organizations that are under CIAs, something that the OIG monitors are expecting. And we are usually privy to some of those questions that the monitors are asking, and they are really asking about how is the compliance committee, how are they involved in the risk assessment process. So this will be something that I would say of a takeaway is really evaluate the level of engagement by your compliance committee. Historically, it's been for those of you who have served either as compliance officers, internal auditors, such as several of us on this call, when you present the risk assessment, a lot of times, here's the risk assessment results, here's the work plan, compliance committee, take a look at it, approve it, and move on. There's a lot more engagement related to those compliance committee members. So as you think about your own compliance program and the compliance committee membership structure, really take a hard look at those that are on the committee, what type of education is being provided so that there can be that active dialogue. There's an active discussion related to key risk areas. And from personally have been in internal audit, one of the areas, I guess the biggest gap that I've seen has been when we have been presenting, we as compliance officers or internal auditors, presenting a risk assessment. Sometimes we are just presenting the activities that are actually going to be on the compliance work plan. One of the things that we might not be showing are all the risks that were assessed, the ones that made the plan, but the ones that are not making the plan. So that there is that active dialogue with the compliance committee to say, we can't address all these risk areas. Number one, we don't have the resources, or, there's just so many for us to absorb. And it's that time for that compliance committee to really have that hard dialogue related to, are these areas that we may need to outsource? Are these areas that as a compliance committee and then subsequently to the board, can we accept the risk of not addressing these right now? And number, three, exactly, even those, we may not be able to address it as a compliance committee or a compliance department. What are those mitigating risks that are risk factors and mitigating controls that those particular areas are going to be implementing until we can get to having those on our compliance work plan? So I would say just, I know we talk about this in a couple of paragraphs in the compliance program guidance, but there's a lot more meat to this particular topic that has been raised by the OIG.
I think what's also interesting to add in this new guidance is, in addition to everything Shannon just said about the compliance committees having that active involvement, there's that expectation stated that member attendance is to be monitored. The board's expecting that if you're a member of the compliance committee, you're actively involved, actively attending, and that the CEO could, if you're not attending, there could be disciplinary action, or evaluate, do you have the right membership on there? Do you have someone on there that has so many responsibilities that they need to have a designee to participate, to serve as that subject matter expert? So just know that's actually explicitly put out in these guidance too, is that expectation of that participation.
Great. So you'll see as we talk through the rest of the slides, you'll sort of see some of these come back and make an appearance later. But let's talk about one of the first sections in the GCPG is a focus on regulations, so healthcare regulations. And one of the things that I did was I skimmed through and read all 91 pages to identify the areas where, from a compensation valuation perspective, there are areas where, sort of hot topics or areas where we think that there will be, some more focus. And as Traci mentioned, there's some really good tools, I think, that are in here that help facilitate how you implement and look at some of the regulations that they've called out. But the first one they talk about is the anti-kickback statute. And there's a paragraph or a sentence actually at the very top of the page that starts on this section that says individuals and entities should evaluate arrangements that implicate the statute and do not fit into a safe harbor by reviewing the totality of the facts and circumstances, including the intent of the parties. So a lot of what they're going to talk about here is, what is the intent of the arrangement? And then Traci's point about the 7 elements, there's focus on are the items that you've looked at documented. So one of the things that this section does in the AKS, though, is there is a series of basically 11 sections that they highlight, and those 11 sections are identified on the next 2 slides, where they highlight the things that organizations need to pay particular attention to. And the other really nice thing they do is they not only say, okay, here's the item that you need to focus on, but they give a series of questions under each one of these topics. And so one of the things that we did is not only do we do fair market value compensation for our hospitals, health systems, and other organizations we work with, but we also do commercial reasonableness assessments. And a lot of what is focused in this section is, we were actually happy to see, included in our commercial reasonableness checklist that we utilize, and it is on our website and available to anybody to access. But if you take that in conjunction with the questions that are on here, you should be hitting the key items as it relates to some general compliance areas for transactions or arrangements that you have. So just to highlight a couple of these, the focus is on the nature of the arrangement between the parties and really looking through for what influence do parties have between each other, and is that relationship and the nature of that relationship intended to directly or indirectly generate business to a hospital or health system. The manner in which the participants were selected, there's a question related to how did you determine this was the arrangement you were going to enter into with this particular participant. So again, it's thinking through, why am I doing this arrangement? Why that with this particular party am I doing this arrangement? The manner in which the compensation or remuneration was determined, that really gets into the concept of volume or value. So thinking about why are you entering into the arrangement, but also does it take into account any volume or value of that business? Again, I know I've said it a couple times, but fair market value, they talk about what's the value. So we're mixing some of the fair market value commercial reasonableness concept here, but is the arrangement and the payment for the service or the compensation consistent with fair market value? And getting to the documentation part, was it based on a reasonable methodology? They don't tell you what a reasonable methodology is, but you do have to look at and say, was a reasonable methodology used? Is it uniformly applied? And is it properly documented? So, documentation. And then looking at the items or services provided. And this is where they actually specifically, this is taken almost verbatim from the document, but they do talk about, is the arrangement commercially reasonable and those services actually needed? And do those services fulfill a legitimate business purpose? So that's kind of where our commercial reasonableness checklist goes through and says, are you fulfilling with this transaction or this arrangement a legitimate business purpose in the absence of a referral stream? So Traci, you can go to the next slide. We'll just hit on these pretty quickly. One of the things that they're also concerned about is, the impact of arrangements to overall, federal program dollars. So thinking about how does this affect the cost that we have and the impact to beneficiaries, and can the arrangement lead to over or inappropriate utilization? So focusing not only on the compensation and the reasonableness of it, but what's the impact to Medicare and Medicaid program. They focus similarly on the clinical decision-making side, on areas about, are you entering or are you in an arrangement that could potentially interfere with or skew clinical decision-making. So there is some specific wording and questions related to both clinical decision-making and steering. And, really interesting, under those two sections, they actually use the language, could the payment structure lead to cherry picking or lemon dropping? So, they are really focused on do any of these arrangements create either inadvertently likely a situation where care isn't provided in the manner that it should be provided. Conflicts of interest, and then again, second time in the same section that we've heard about the manner in which the arrangement is documented. So that hits at least from our perspective, the sort of the highlights of that regulatory section. They do, though, go through Stark, they go through some other regulatory components that we certainly don't want to gloss over, but when you think about what we do and what we're getting asked about, that was the one area that stuck out as really important to us. I'll turn it over to, I believe, Shannon.
Absolutely. So as Traci mentioned, when you print it out, you get 90 plus pages without all of the links. And so as I was reviewing this, I was really looking at this from the perspective of, if I were to conduct a compliance assessment, either from my own organization or from serving as a consultant in this area. And so these are just some of the areas that I called out as being not necessarily unique, but certainly given a lot more scrutiny in the last few months related to some of the guidance that we're starting to see out related to this. But the first one that I thought was important to note was the fact that they really talk a lot about the intersection of quality and compliance. And as Traci mentioned, there's some really good examples that they provide of that. Before, a lot of us didn't really know what it meant to have an effective compliance program. Now they really are giving a lot more guidance. And the area related here is quality. So some of the examples given is what type of information is being shared between perhaps the quality committee, the quality officer with the compliance officer. If there is any type of a quality issue, what are the implications from a compliance perspective, from a billing perspective? Really goes hand in hand with some of the maybe some of the corporate integrity agreements that are related to quality of care. So I think that's of note. This has also been an area of really not necessarily scrutiny, but evaluating what level of involvement within your organization do you have with those that are charged with quality, and how are you ensuring that you both are, or both of your teams are actually communicating appropriately, and how that really does impact compliance with your organization. Reporting relationships. This is one that we've seen, and certainly in corporate integrity agreements. It was very clear in this particular document. In fact, it's in bold that the compliance officer should not be general counsel nor report to the general counsel. So that was in bold. We know also that there's organizations where this occurs. So I would just say from our perspective is really evaluating that. We do see a lot of questions if you're under a corporate integrity agreement, a lot of questions that the monitor will raise about this particular reporting relationship and what does this really truly mean to your organization. So really take a hard look at your reporting structures and to see how you would actually be able to comply with this particular expectation. As we mentioned before, compliance committee is getting a lot of focus. Member attendance and participation included in each member's performance and compensation evaluation. As Traci mentioned, this is an area that is fairly, when we do compliance assessments, it's fairly new to actually include the evaluation component of a compliance committee member. So when you really start peeling back the layers of what they're looking for here is not only, participation, but active participation, really documenting that and really having that charter, having the expectations outlined, looking at membership, making sure you have the right members in place, making sure you're having actually, that active dialogue and conversation. Another area is related to board. And I would say that the board is not just the board for the overall organization, but you could actually have a board subcommittee that would actually serve in this capacity. So, for example, the compliance committee of the board would serve in this capacity. But the board or board subcommittee should be meeting with the compliance officer no less than quarterly and reserve time each meeting for executive session absent of management. In many cases, we see where the compliance officer is actually presenting maybe on an annual basis. But again, looking at your structure, do you have a board subcommittee where you're probably likely having those quarterly meetings? And then that board subcommittee, probably the chair of that subcommittee is actually providing those reports to the board. So I think that would meet this particular requirement. Board is also to evaluate the compliance committee's risk assessment process. So when you start, again, looking at the layers of what this actually means, do you have a documented risk assessment process? And rather than just presenting the results of that risk assessment to that board or that board subcommittee, are you really having a dialogue about the process? Some of the best practices that we have seen is in advance of your actual risk assessment process, where you're probably conducting those interviews, you're really looking at the external guidance that's available to you, is really having that dialogue and that education of that board or that board subcommittee in terms of, here's our process, here's what we're going to be looking at, here are the questions that we're probably going to be asking of senior leadership, here's how we're going to evaluate that, so that committee can actually weigh into it. A risk assessment process, I always think about, if you think about a document, have a heart on it because it's a living, breathing document. It's something that you're always going to continually evaluate. And a risk assessment process really is an ongoing. It's not just a one-time event. It's throughout the year, because as we know, regulations come and they change and they morph into more regulations. So it's always a good idea to really have an annual risk assessment process, but have touch points along the way. Also, from a board perspective, receiving annual reports, again, on the entity's effectiveness in addressing and resolving compliance committee identified risks. So when there is a risk that's been identified, as I mentioned earlier, there's different ways that you can tackle that. Is it to maybe have an outside review performed? Do we have capacity inside to review that particular area? What are the controls that management is responsible for mitigating that risk? And if there's just something that we just don't have the resources, is it something we're willing to accept that risk? So making sure, again, that's part of that documented risk assessment process. As it relates to training, a couple of the tidbits that we thought were very interesting is really ensuring that there's a mechanism for participants to actually ask questions about the content. So when we think about the training mechanisms that are rolled out, it could be through an online system, it could be through maybe certainly in terms of evaluation or annual reviews. It could also be part of the orientation process. But is there a mechanism for participants to actually engage in those particular those sessions, not just receiving content, but do they have a mechanism to ask content? Also, that participation is a condition of continued employment or engagement, meaning if you have an outside contractor, that's part of the engagement process. And then it is a condition of participation or continued employment to actually participate in that training and education. And that is something that we do see quite a bit. A couple of other areas related to training, again, compliance committee members, again, the central theme here, quality compliance committee members, they're really hitting this pretty hard, should deliver compliance training. So if you think about it, who delivers compliance training for your organization? In most cases, it's your compliance team. It's part of your annual education rollout. This is actually articulating the importance of compliance committee members. So if you think about within your organization, who's on your compliance committee, it might be, your head of HR, it could be rev cycle, it could be CIOs. It's just making sure that those individuals are also helping to further the education within your organization. Maybe they're having touch points within their huddles. Maybe as part of, if you have periodic management meetings, management retreats, that there is ongoing education throughout the year delivered by the members of the compliance committee. As it relates to investigations, again, the compliance officer should stay involved in all healthcare compliance investigations in which counsel takes the lead, making sure there's that active communication and dialogue between counsel and the compliance officer, just to make sure that there's both perspectives being factored into those investigations. Areas that we're seeing over the last, I would say over probably the last 6 to 12 months related to incentives for compliance. If you recall, the Department of Justice actually provided some additional insight related to incentives and incentive measures. And so that is actually being articulated also within the OIG document as well, is looking at, what incentivizes compliance. So whether it's additional compensation, whether it's significant recognition. So again, it's not just incentivizing for elements of your performance evaluation. It's really taken it a step further in terms of incentivizing for compliant behavior. Maybe you have a department that has, if you've trended and looked at particular areas of emphasis within that department, are they doing a great job? Maybe taking a look at ways to incentivize for good compliant culture and hygiene related to compliance areas. And also assess whether other incentive plans can be achieved while operating in an ethical and compliant manner. And what they're talking about here is really understanding what is driving behavior. If it's sales goals, are there certain factors that could actually deter compliant behavior for sales goals? If you have an organization that is serving as an outsourced vendor, how are they being incentivized? I know several years ago, many organizations had some issues related to wound care management and how those particular outsourced vendors were being incentivized. The same thing, are there certain admission goals? So really looking at your incentive measures. So that could actually be a separate item on your compliance work plan, is to really understand how are those within your organization being incentivized. Next slide. We're going to go back to risk assessment. So again, some of those key themes. So from an action item perspective, is really speaking with your compliance committee about the risk assessment process. As I mentioned, there are many resources that are available related to assessing risk. And what I thought was interesting within this document, they're actually referring to COSO, the ERM framework, and other outside non-traditional reference materials. For those of you who want to geek out and look at the Green Book, and also the U.S. GAO, the General Accounting Office, some of those additional guides and resources that Traci mentioned, there's certainly those links to those materials. The next one related to use of data analytics and metrics. I remember years ago, I was sitting in a class, and one area of emphasis was don't ever let the government or other parties use your own data against you. Really looking at your data points and your elements that you have available to you, because others are watching and looking at that and making sure that that is a true input in terms of your risk assessment process. The OIG toolkits that are there, the OIG website is really being revamped, and a lot more information is being provided than there ever has been before. And then the guidance actually notes some common compliance risk areas on page 34. Certainly billing, coding, we're all very familiar with those areas, but as I mentioned earlier about sales and marketing, who's involved in marketing your services, who's involved with determining physician compensation, who's involved in referral source arrangement, and really looking at those areas of compliance risk. And then, as Traci mentioned, the OIG indicated that specific compliance guidance for subsectors such as lab and skilled nursing will be rolled out starting in 2024, and we're already starting to see some of that being rolled out as well. So next slide. Oh, we're going to our next polling question. So moderator, take it away.
Yes, so our next polling question is, my organization's compliance committee is engaged in the risk assessment process. Yes, compliance committee is engaged in the risk assessment process, or no, this is handled by the compliance department. Remember, you must fill out the polling questions in order to receive CPE credit. You will have 30 seconds to answer. Thank you for participating in our poll. Now I'll hand it back over to our presenters.
Okay, I love to see this one. Yes, the Compliance Committee is engaged in the risk assessment process, 65%. I would say probably in the last 5 years, that would have been probably not quite as high, maybe 20%, just to kind of guess. All right, next slide. Okay, a couple of other areas that we thought was, that was really interesting and important to note here is related to compliance programs vary. As certainly as Traci had mentioned earlier, this program guidance is not a one-size-fits-all, and certainly in the materials towards the back of the compliance guidance document related to how to handle compliance for smaller entities. And smaller entities are really defined in this particular guidance materials like a small physician practice. So as you think through what resources are actually available in a small practice, the compliance contact, there may not be a compliance officer, but who exactly could be that person that the associates or the employees could actually turn to for questions. But what they do say here is that, at all costs, the person should not have any responsibility for the performance or supervision of legal services whenever possible, and should not be involved in the billing, coding, or submission of claims. And we know that sometimes this can certainly be a challenge as it relates to oversight. If there is no board, then the compliance contact should provide at least an annual report to the owner or to the CEO. OIG resources are online for training, so not everyone is able to actually create their own training materials, but as we've seen over the last several years, there's actually been a lot more training materials that are being provided for customization by the OIG. And then policies for that good faith reporting of compliance issues and prohibiting retaliation, including posting information about the OIG hotline. Obviously, not everyone's going to have their own hotline. So to make sure that those employees actually have access to the OIG hotline. And then again, for risk assessment, it really doesn't have to be complicated. What they do say, there should be at least an annual audit. So for example, in a small physician practice, looking at your coding and documentation and your billing is probably your highest risk area for a smaller entity. Mm-hmm. Related to large entities, they said that certainly they expected a department of compliance personnel, but also for those really large organizations, consider maybe a deputy compliance officer, which is responsible for specific areas such as audits or investigations or training and policies. And that is something that we see a lot, where you might have a very large departmental structure. You might have one individual that's really specifically focused on training and conflicts of interest and looking at maybe the exclusion listing, but you may also have someone that's very specifically dedicated to any type of external audits, RAC audits that may occur. Blend the various skill sets, certainly as we're seeing now with cyber and data analytics and clinicians and auditors, very dynamic and very complex compliance department personnel. Also, compliance subcommittees. Again, kind of going back to the whole risk assessment theme, is that we are seeing organizations that may have a specific subcommittee that's truly dedicated to the risk assessments, the policies and procedures, to training and education. And then a separate board compliance committee, again, kind of combined with that audit committee. International organizations, they do call out if you do have international involvement, that they should ensure that the parent board is well versed in U.S. federal healthcare program requirements. We have seen some organizations that may have a parent company that may be in another country. As we know, those rules and regulations vary quite differently related to how they may participate in healthcare and federal programs and funding than the U.S. healthcare. So making sure that those organizations understand the complexity of the U.S. healthcare environment. And on this particular slide, so we talk about other compliance considerations, as we mentioned, forthcoming guidance will have those industry subsectors of specific risk areas. And Entities should incorporate quality and the patient safety oversight into their compliance programs. The board should require those regular reports from senior leadership. Again, it's emphasizing that compliance is not just the compliance department. It's various individuals, various leaders within the organization, and making sure that those individuals are actively engaged in that compliance committee. And that the compliance committee should include those members responsible for quality assurance and patient safety and adequacy of patient care. So really looking again at the intersection between patient care, quality, and compliance. Quality audits and reviews should be included in the compliance work plan. I thought this was an interesting add to the compliance program guidance, again, kind of collaborating with those various functions. And that compliance committees should also assess staffing for nursing, therapy, and other clinical services. Again, this is a new add, something I know that I haven't seen a whole lot when we've done compliance assessments related to the involvement of those compliance committees, again, with quality and patient safety. And then obviously that the compliance officers should develop those productive working relationships with various, what we call other assurance providers within the organization. So as we continue risk assessment, we're not going to beat this horse anymore on this particular webinar, but again, I think you all get the gist about risk assessment. New entrants into the healthcare industry, they do recognize, as Tynan had mentioned earlier, about PE or venture capital firms. We're seeing a lot of startup entities that may not be well versed in the various elements of healthcare regulations. Certainly related to, I think, with HIPAA and privacy and PHI, there's a lot more entrance into this particular area that may have not had this particular skill set before. They talk about, and I love this this acronym they're talking here, is certainly the following the money. Again, private equity and other private investors, governing bodies should really scrutinize if you have any type of relationships with organizations that are PE-backed and understanding their incentive structures. As it relates to those financial arrangements, ongoing reviews and approvals of those financial arrangements that Tynan alluded to earlier, and then regular reviews to keep billing and coding practices up to date, and regular internal billing and coding audits. Again, some of these areas are areas that you're very familiar with. We just wanted to call attention to a few of those topics that we may not have considered in historical, guidance materials. Next slide. All right, Tynan.
Yeah, and interestingly, there is this whole section at the end of the document that talks about sort of these other compliance considerations. So it's like if they couldn't fit it anywhere else, it got segmented into sort of this bucket of other considerations. And one of the things that again for us gives us some insight into, what is the OIG thinking, and as we think about what do we need to have top of mind, there are these tidbits sprinkled throughout that give you some insight. And one of those is this section that's on specifically on financial arrangements tracking. And if you go about, I know it's tiny print, but if you go about halfway down the paragraph, there's a sentence that starts with entities, and they say entities should consider what type of centralized arrangements tracking system to establish depending on the size of their organization. So that's getting back to what Shannon talked about, small versus large, to ensure that the proper supporting documentation is maintained, those legal reviews are being regularly conducted, and that fair market value assessments are performed and updated routinely. And so interesting there was a focus not on just the have it documented, but a focus on sort of how you should maybe have some of your documents organized. Do you have a centralized tracking system? Do you not have it? Are you using Excel versus are you using something that is a little bit more sophisticated? Again, nothing says you have to. You've got to scale it depending on the type of organization you are, but clearly a focus on how are you tracking, how are you reviewing, how are you monitoring, and how are you updating arrangements that you have, and then specific call out relative to lease space and equipment to ensure that those are consistent with contract terms. So again, it's fascinating to me how there are these sort of, I'll call them zingers, but they kind of appear in these sections where if you kind of don't read it, you might be missing sort of a hint as to some of the things that we might be seeing coming down the pike in terms of areas that are more highly scrutinized. So as Shannon said, nothing earth-shattering, sort of a lot of the same things that we've seen in the past, but clearly a call out on areas that are going to continue to be a focus. Traci, I think this gets to our third polling question, turning it over to the moderator.
So our third polling question is, our compliance committee receives regular reports from senior leadership on quality, patient safety, and adequacy of patient care. No, these are distinct and separate committees. Not now, but we have plans to do so. Yes, but in summary reporting only. Yes, audits are conducted by compliance. Or yes, both quality and compliance present reports at each meeting. Remember, you must fill out the polling questions in order to receive CPE credit. You will have 30 seconds to answer. Thank you for participating in our poll. Now I'll hand it back over to the presenters.
Thank you. Oh, wow, we're kind of all over. I like that. I think the fine dance too for us all to adapt to in the future is, making sure the information is getting reported, but you just don't want to be repeating the same information meeting after meeting. So having that fine dance of how you design it. So this is great, thank you. Oh, I just had some great things I was talking about and you didn't even hear me, sorry. Well, thanks for everyone for participating. What I was trying to say is I appreciate the responses and that just that fine dance of, how are the different committees such as quality and safety and all those, how to make that work with your compliance program. So, because you don't want to have meetings where you're repeating the same information meeting after meeting. You still want that good content and that oversight. So how do you want to make that, how do you manage that in your organization to be effective? Okay, next we are going to, hopefully, I'm not going there, thank you. So we're going through a few enforcement actions. This one was interesting that occurred back in January of this year, a whistleblower complaint. And what's ironic here is that the compliance officer was in fact the whistleblower. In this particular case, there was alleged illegal remuneration for providers that were receiving ancillary support, such as nurse practitioners, hospitalists, physicians assistants for the inpatients at the hospital. And it was seen that this was inducing those providers that they would then have more patients come to that institution. So, we've heard different remuneration before, but this is where the actual compliance officer was the whistleblower. So you just have to be aware of those different, how is the involvement of the compliance officer, how's the follow through, the buy-in, the oversight.
Traci, one quick thing on that one too, that is, it really gets back to following the money. and do the revenues that are the compensation that's being paid to the person providing the service, are they actually also bearing the expense of that service? And interestingly, we've reviewed arrangements, very similar arrangements, and those are complicated arrangements, and it's really understanding operationally what's going on and following the money. So I think when you've got more complicated arrangements like that it's you almost have to take a really high level step back and just, where's the money flowing, who's getting the revenue, who's bearing the expense, and you can pretty quickly get to an answer. But some of those more complicated ones, it's doing that, and it's thinking operationally what's happening.
Absolutely, and just to stress on the fact that you can track how that money is going. That it's not hidden, but you can actually reconcile where it's all being managed. This next case occurred back in May of 2023, in which physicians agreed to pay $1.5 million plus interest for false claims that they were misrepresenting severity of illness and services rendered for Medicare Advantage patients. In fact, that there was unsupported diagnoses that increased reimbursement. In particular, in this case, it had to do that codes for morbid obesity were being submitted, but the documentation didn't support that. It's very defined that to be diagnosed with morbid obesity, your body mass index had to be over 35. And in these cases, the majority, they're identifying that wasn't the case. In addition to the diagnosis, was the CPT code that they were doing a 99214 that the documentation wasn't supporting that complex medical decision making. And then lastly, there was supposed inappropriate billing for physician assistant services incident to the services of the physician, including the physician. So, and the physician happened to be out of country at this time. So they were charging incident 2 for the services from that physician assistant for the physician, but the physician wasn't around. So it's just interesting just to understand, all the different possibilities that occur with these cases and the need for that auditing and monitoring internally too. Can you advance my slide, moderator? Oh, back one more. Thank you. Now, this last case was back in December of 2023. It was a false claim for overbilling COVID tests and office visit. In this case, the physician performed office visits, or the claims were indicating that the physician performed the office visits, but a non-physician provider was actually performing that. And so reimbursement was higher than was necessary. In addition, if you all recall, during COVID, there was a program for the uninsured. And again, in this particular incident, they were charging they were upcoding some office visit claims for vaccinations, visits for COVID, or the vaccinations for that uninsured population and getting reimbursed for that inappropriately. Next slide.
I think that brings us to the end of our time.
That does. Oh, and we're right on the money. It's 10 o'clock, or well, 10 o'clock my time, sorry. But anyway, thank you everyone for dialing in. As I'll leave this over to the moderator to kind of give you some closing pointers, but we appreciate you. We hope to see you again on another webinar.
Thank you for listening to this PYA webinar recast. The video recording, slides, and associated material for this and all PYA webinars are available on our website. If you have any questions or if we can help, please contact us at pyapc.com. Thank you again for joining us, and have a great rest of your day.